So looking at the your very comprehensive journey in development sector covering hospital, public health, health systems, research, teaching. So could you please share like one or two like moments of impression like which left an impression on you during your whole journey? So would like to know those things, sir.
I think there are many, Dr. Tuka. I would, since I said, let me recollect again the same thing from Bihar because we just talked about, state of Bihar. Uh, the healthcare utilization was higher, but still the indices, many indices were very poor for long time. And then UNFPA asked IHMR when I was a faculty there to strengthen the HMIS system there. And when we went, we just interviewed different cadre of people. Forget about the higher class, I mean the lower class people like Asha NM. Even at the district level, state level, people didn't know the importance of HMIS. The basic elements which they get from the state, and based on which they provide the data and prepare report for decision making. They had no understanding of those elements. People didn't know what is the difference between zero, blank, and things like that. No basic thing. So, and then my promoter of my institute, I still remember Dr. Ashok Agrawal. When I met him in one of the meeting while I was doing the project in the beginning of that during inception period, and he says, Dr. Santosh, if you are doing the HMIS, I think tell me, give me some linkage that because of IHMR interventions, if we are able to reduce the vital indices, say IMR or MMR of that. At first stage, I got perplexed that how is it possible that improving HMIs and can be linked to improvement in the health and basic health indices and important health indices. But we started working on that. We had kind of interacted with different level of people like HMI, HMIS, ASHA worker, ANM. Then I think we didn't cover ASHA, but we started with ANM, then block level staff, MOIC, district level staff, headquarters, and the senior level staff, including health secretary and all that. So in this his organization, and uh, developing trained more than around 20,000 people. Out of that, around 2,000 people would be at district level and state level, and then more than around 16,000 people will be about district block level, the village level, which were including ANM and nursing staff and all that. So uh, with that, I think what we saw that after our training program, the and nurses were very enthusiastically used to started getting collected. For them, data makes started making sense that this data is not only a data. This is something which will help them for do a better planning. This will help them to improve uh, the coverage of their programs which in which they are involved. The healthcare, the block level people or district level people started using those data to ensure that if somebody is left in their area, if something left, do we have is it a resource which is reducing the I mean, impeding the work, or is it the knowledge which is impeding the work, or is it the mismanagement or lack of coordination between intersectoral thing which is actually hampering their task and all that. So those kind of things started happening at the state level. They started the health secretary was so dynamic, Sanjay sir, who is now I think is into government of India. So he started tracking the district level officers' work, and there was a kind of a sense of competition among the district was created. Though government of India had started that earlier, but in Bihar we could bring that, and I could see that in very short period of time. Of I think the project was for 5 years. Initially, it was 2 years, and then extended for 3 years, and then 5 years. So because of our contribution, and thanks to you also, I remember you were there and you were in the one of the uh, coordinator for two or three, I think, different zones and different times. So you could see that I still remember one of the impactful moment when uh, after at the end of the 5 years, people at every level started and appreciating the role of data. Earlier, it was just reporting. I remember one day I was having a meeting with one of the zonal coordinator, and he got a report from his state that has been found that your malaria cases in your city is has gone up. Please explain why. And his simple reaction was that now onwards no malaria case will go up. So which means that he will not report it. But after our interventions, I think that change of no that mechanical reporting stopped. People started using that for some with some responsibility, and they started using the data for improving the quality of care, and that has actually led after some time. I think UNEP also did some. We recommend government of India should do that, but I think now gradually with those interventions, the healthcare indices of Bihar has really gone down. We should at least someday do a really kind of analysis pre HMIS project and after post HMIS phases. If the rate of at which the incidences has reduced, uh, and so if the rate is really substantially reduced after and pre and post, I think we can conclusively say that. But in absence of those data also, uh, I think that was something which is very satisfying because people in all among the all stakeholder give that positive feedback. Second thing is, of course, you could see that after my involvement in the public health system and all that, you could see that in different part, of course, not only UP, Bihar, and of course in Afghanistan, that to a great extent we are able to provide the basic care, not the tertiary level. At least the primary care has really gone to the level where it should be. So these are the two, I would say, that impactful moment for me with our team members we could achieve.